Hi everyone, I'm Emmy. For this week, I'm doing the review section. So the big questions that I will be answering today first is describe the study's methodology and results, how was study conducted, and why were the particular methods chosen, highlight key results from the study, and then next I will answer, I'll present the author's conclusions and their perspective on the study results, including explanations of inconsistent or unexpected results. So to answer the first question, the study's methodology and results, it's a qualitative study. So they describe their study as 6 focus groups with nurses, residents, and attending physicians using standardized, semi-structured focus groups, focus group guides to promote discussion. The focus groups were recorded and transcribed, and results were analyzed by 2 independent reviewers to kind of identify the themes. So I thought it was important to note here before I move on that they identify the aim of the study as using these focus groups to better understand the barriers preventing nurses and physicians from effectively communicating with their patients. And they kind of had the secondary aim of the study that was the factor to identify the factors that promote effective assertive communication, which is really what they're trying to identify here, is that notion of the assertive communication of the nurses and the doctors and the practitioners to their patients. So where they did the study was at a large children's hospital, something like 400 beds or so, I can't remember. For children, like I said, they picked long-standing resident physicians, long-standing nurses. They had to have done at least a month of rounds, been there for 6 weeks, and the nurses in particular roles. So what they were looking for is these people who could come into the focus groups and promote this open and honest dialogue and communication. They were semi-structured focus groups. They kind of asked some open-ended questions, which I thought was really cool that they included the exact questions that they asked them within their study, so you could kind of grasp where these results were coming from. I don't feel like a lot of studies often include the full list of questions. They'll kind of do an overview, but we get them all here, which is awesome. And then each of the focus groups lasted at least 2 hours. They recorded them and included the questions, like I said. So the three main results were 3 themes with 8 sub-themes. I didn't do all the sub-themes. They kind of gloss over them and wrap them up into their 3 main themes. And they do a really good job of it. It's just less important. But the first theme was interpersonal factors. So they identify that as perceptions of power, relationships, working with the patient for a while, knowing their name, definitely lessened the barrier. And then personal communication styles. So if they know that a patient's going to respond positively to the assertive communication that they have, they were more likely to do it. The second main theme was organizational factors. So they identified some standardized means of communication, the SARBs, as they talk about, and then the size and technology of the hospital. So are they having these conversations face-to-face? Do they know these patients? What technology do they have to communicate with their patients? And then the last main theme that they identified was the complexities of care. So oftentimes they identified that there were large groups of doctors caring for one patient, and then each of these doctors had multiple specialties. They all felt like they were experts in their realm. How do we kind of bridge the gap between, these multiple doctors with the multiple specialties? So then moving on to the author's conclusions, which is a nice segue from these main themes. The big conclusions that I took away from the authors were that they really identified that the less experienced nurses felt less comfortable expressing themselves. That didn't really come as a shock to me, but it is an important theme to note when you're providing care and in that kind of role. They really highlighted the benefit of the pre-structured communications, the SARBs that they mentioned, and the importance of agreement among care providers with systems in place that kind of streamline the communication. So that kind of goes back to each of the 3 main themes that I identified earlier. And then one quote that I really liked that kind of summarized their conclusions was, when considering optimal communication practices, understanding the role of relationships and hierarchy in the care delivering setting is important. So that kind of encapsulates all 3 of their main themes. It brings it to a nice conclusion. They didn't find a lot of things that were unexpected. They didn't really find anything that they weren't already kind of expecting. They at the end they kind of summarized up some nice future considerations. So they wanted formalized communication training to promote and support effective assertive practices is warranted. They wanted more studies done in that. They also found that their results corroborated with the findings in other settings. So they did a pediatric hospital, but the findings from similar studies in non-pediatric hospitals kind of backed up what they found. So then they also addressed two of their limitations, which is important to their conclusions, is that they only had 2 focus groups due to monetary reasons. Obviously, that's usually the biggest restriction. And then all of the people in the focus groups had the same role. So they didn't have like the specialized doctors interacting with the nurses, so on and so forth. And I thought those were really important to kind of contextualize their conclusions. So yeah, thank you guys.